Hello and welcome to Pregnancy Info. Today we will discuss the spotting and its causes during pregnancy and how you can stop this vaginal bleeding or spotting during pregnancy. Spotting and bleeding during pregnancy is a common issue. Women commonly suffer from this issue because of different reasons. Spotting is any light vaginal bleeding which occurs at any time other than when a period is due. In many cases, spotting during pregnancy doesn't always mean the worst has happened and it will eventually stop. However, if you notice heavy bleeding, you should be worried and you must check it immediately. You can search more information about the symptoms of miscarriage, etc. and you can watch our videos about miscarriage and its causes too. Here are some common tips that can help you stop spotting during pregnancy effectively. Number 1. Take a rest. The most common cause of bleeding during pregnancy is lack of rest. There are many women who even work harder during pregnancy or continue working in physical jobs. Any kind of stressful task will lead to spotting and bleeding. It is better that you take rest if you notice any kind of spots. Avoid lifting heavy items. Avoid doing daily tasks for a few days because of your body needs some relaxation. Don't use tampons or try to douche. Once you will take proper rest, you will notice that the bleeding will stop. Avoid sex. Most women who have having a normal pregnancy may continue to have sex right up until their water breaks or they go into labor. Therefore, there are many couples who don't stop having sex even when the woman is pregnant. You should know that in some cases, sex can be the cause of spotting or bleeding during pregnancy. As soon as you notice any kind of spotting during pregnancy, it is better that you avoid having sex until your doctor tells you it's safe. Normally, you will have to wait at least 2 to 4 weeks after bleeding has stopped. Maintain a healthy diet. Malnutrition might also be the reason why your placenta is not properly established, that is causing bleeding during pregnancy. It is important for the placenta to properly establish, otherwise it would lead to complications during pregnancy. As soon as you will visit the doctor, he or she would let you know about vitamins and minerals that you should be taking to maintain a healthy diet. Ensure that you maintain a healthy diet and do not avoid taking any nutrients because that is the only way you can maintain your health and avoid bleeding in pregnancy. You should know that bleeding during pregnancy can occur at any stage. If you notice that breast and diet are not helping you out, the condition might be because of some serious issue. It is better that you start using pads so you can know how much blood you are producing as well as the color and consistency. Consult a doctor as soon as possible because he can provide you the required guidance regarding your condition. You should be extra careful when you are bleeding during pregnancy because if you will not take the required steps, it might lead to abortion. Follow the instructions of your doctor. Causes of bleeding and spotting during pregnancy. There are different reasons of bleeding or spotting in every trimester. Once you understand the reasons for every trimester, you will be able to determine the next action to do. Bleeding in the first trimester. The likely causes of bleeding in the first trimester include Number 1. Implantation bleeding. It usually occurs 10 to 14 days after conception. Pregnant women report some spotting which is quite normal. The reason for this is that the fertilized egg implants itself in the uterine lining, thus causing a little bleeding. The bleeding is very little and only lasts for a couple of days. No wonder some pregnant women may never realize they are pregnant and assume it to be the onset of menstruation. Number 2. Miscarriage. Miscarriages can also cause bleeding during pregnancy. Miscarriages are common during the first 12 weeks of pregnancy. However, bleeding in the first 12 weeks doesn't mean a miscarriage has occurred. As a matter of fact, a high percentage of women who experience bleeding or spotting in this period will not miscarry. There are other symptoms associated with miscarriages beside bleeding, like miscarriage painful cramps and passage of tissues in the vagina. If you observe this along with bleeding, then you should see your doctor. Number 3. Ectopic pregnancy. For a pregnancy to be deemed successfully, a fertilized egg must travel through the fallopian tube and attach itself to the walls of the uterus. However, there are situations when the fertilized ovum evolves into a zygote and the embryo, and instead of attaching itself to the uterus, it attaches itself to the fallopian tube. This is what it referred to as an ectopic pregnancy. As the attached embryo continues to grow in the fallopian tube, it will burst because it doesn't have the necessary space to grow. The burst causes a lot of bleeding, which can be a life-threatening condition. Number 4. Molar pregnancy. This is a rare condition that involves the growth of tissue in the uterus instead of a baby. Fortunately, the tissue is rarely cancerous. Number 5. Cervical changes. Sometimes the bleeding or spotting during pregnancy could be a result of intercourse or taking a pap test. These two actions cause extra blood flow to the cervix, thus causing bleeding. This type of bleeding is not a cause of alarm. Number 6. Infection. There are certain infections in the vagina of cervix that can cause bleeding during pregnancy. STIs are particularly notorious for such bleeding. Bleeding in the second and third trimester. When you find yourself bleeding in the later stages of pregnancy, it could be an indication of something more serious and you might need medical attention. Bleeding or spotting in the second and third trimester of pregnancy could be caused by: Number 1. Placenta Pria. This is a condition where the placenta partially or completely covers the opening of the birth canal. The lowering position of the placenta can cause some bleeding or spotting from the cervix. Number 2. Placenta abruption. There are rare cases when the placenta detaches itself from the wall of the uterus before labor. As such, a lot of bleeding will occur. It is a life-threatening condition that must be treated. Number 3. Uterine rupture. Sometimes the uterus have a serious condition. The uterine wall can rupture, causing bleeding during pregnancy. This rupture could be caused by a tear of the previous C-section, scar, or another reason. Number 4. Vasa previa. Vasa previa is a condition where the baby's blood vessels located in the placenta cross into the birth canal. When they tear open, they can cause some bleeding. Vasa previa is a very rare condition. Number 5. Premature labor. Premature labor is something that many pregnant women may experience. Preterm labor occurs when regular contractions result in the opening of your cervix after week 20 and before week 37 of pregnancy. Preterm labor can result in premature birth. The earlier premature birth happens, the greater the health risk for your baby. Number 6. Cervical or vaginal injury. An injury to the cervix or vagina from external penetration or forces can cause bleeding during pregnancy. This form of bleeding doesn't have anything to do with the baby's condition but your vagina or cervix, though you should see to doctor to treat the injury and avoid any chance of infection. Number 7. Cancer. Cancer can affect different parts of a woman's reproductive system and cause some form of bleeding. Whether it is cancer of the fallopian tube or of a cervix, there will be some bleeding or spotting because of the condition. In conclusion, as you can see, bleeding in pregnancy could be because of normal or abnormal conditions. Sometimes you may not know whether it is normal or abnormal, so it is good to talk to your doctor when you experience it either in the first or last trimester. So, share this information with the women who are pregnant and facing some spotting or bleeding in their pregnancy session. Thank you.